Hi, Chris here again, and this is my fourth video in my prostate cancer video diary series. Today's topic is all about the prostate biopsy. Now, just as a reminder, I'm recommending that all men after the age of 40 have your PSA level tested so you know your own risk for prostate cancer. If you're watching this video, you too may be going through your own prostate cancer diagnosis or treatment. Now, to share a little bit about my own experience, the first thing that I want to tell you is that I had a lot of anxiety and concern going into the prostate biopsy. And I'm happy to say that they were all unfounded. It's a very simple, painless procedure. So if you too are looking to have a prostate biopsy performed, just know that it should be a relatively easy, painless experience. Now, before we got to the prostate biopsy, there were several steps that my physician and I took to determine whether or not we needed to actually go through that procedure. The first thing we did was a second PSA level test. After my first PSA test came back as a 10, the doctor wanted me to wait a few months and have that PSA level tested again to rule out, anything that I was doing in my day-to-day life which may be elevating that natural PSA level. Unfortunately for me, my PSA level came back at a 10 for a second time, so we proceeded to a physical exam, which was done, right in the doctor's office. The doctor was checking to make sure that my prostate was the right size and shape, that it was not enlarged, although I had no signs that it would be. That exam confirmed that, so we moved on to the ultrasound, which was the doctor inserting a small camera so that he could have some images of the prostate itself. And I saw those images. I don't know really what it was telling the doctor, other than the fact that what he could see was the fact that it was in fact normal shape and size, which we kind of knew. He did see a bit of calcium buildup, which he said is very normal. At that point, I got really excited to think, maybe everything is okay. But in fact, he said that it actually is a reason for concern. Meaning that with an elevated PSA, to see a prostate that is of normal size and shape, that really hasn't seemed to have any abnormalities, that that could be an indicator of the prostate cancer. So following that, he scheduled me for an MRI, which I actually never got around to. The MRI was intended to give him even more enhanced imagery leading up to the biopsy. This can typically give the doctor an indication of where he may want to focus his biopsy. So if he sees anything that is suspicious, he will take more samples from that particular area. Now, the reason why I chose not to proceed with the MRI is that I had a third PSA test as I was walking out the door following my ultrasound. And that test came back as a 13. So I went from a 10 all the way to a 13 in the matter of just a few weeks. So I called the doctor a bit in a panic and just said, I don't think that I want to do the MRI unless there's a particular value to you. I need definitive answers. So if you're okay with it, let's move on to the biopsy and skip that step. And so that's what I chose to do, just because I felt that there was a sense of urgency for a conclusive diagnosis. Now, the biopsy itself, again, was very painless. You have a local anesthetic that they give you, so you don't really feel anything. It's happening kind of behind you, so you don't see a whole lot. One thing to call out is that the doctor was very, very nice in the fact that he sat me down and said, before we get started, I want you to hear the noise that this spring-loaded needle is going to make. I don't want to wait until we're in the middle of the procedure and it's shocking to you. And I don't know how to describe the noise other than the fact that my 10-year-old son was playing with a Nerf gun, and it sounded very similar to that, where you, again, it's kind of a spring-loaded noise. You can imagine in the quiet doctor's office, you're already a bit uncomfortable. To hear that noise could be shocking, so it's good to kind of hear it before you get started. Other than that, there really is nothing at all to the procedure. I drove myself home. I didn't have any pain following the procedure in the days that followed. The only thing to note is that you will have a small amount, hopefully, of blood in your urine. If you have excessive bleeding in your urine, you should definitely reach out to your doctor to see what's going on. The other thing is when you ejaculate, you will definitely have blood in that as well. When you think about it, the doctor is taking tissue samples with a needle in your prostate, so that at that point is just biology. But that goes away after several weeks, so it's not something that you will have to deal with longer term. But just know that it's there, that's happening, so that it's not either a shock to you or possibly your partner. Other than that, just know that, again, it's painless, it's simple. The procedure took about 10 minutes, and at the end of the day, you will have hopefully a conclusive answer on whether or not your symptoms are caused by, the presence of prostate cancer. As always, if you have any questions or comments for me, feel free to leave them in the comment section below. And look for my next videos leading up to my prostatectomy, which is about a week away. So, more to come.